It seems the pendulum is still too far over in this kind of emergency paradigm where it's just people show up, do some work on an outbreak, and then they're off once transmission stops, even though there's a lot of suffering that goes on after the last case has been identified. And there's plenty of health system strengthening to do to prevent the whole the whole thing from happening again. Well, I guess it has its roots way back, over almost 20 years ago now, where I actually lived in Hawaii, in Waikiki, and I attended UH Manoa, studying tropical medicine. And I used that training to move on to my first global health gig, I guess you could call it, was in Sudan with Doctors Without Borders, where I ran the lab based on my microbiology training at UH. And I ran the lab at a field hospital down in southern Sudan, and it was all one country at the time. But essentially, the South was an internal colony of the Arab North. And I got to be friends with some doctors down at a military garrison nearby. And they said to me, Doctors Without Borders is all part of Khartoum's plan and political strategy. And I said, oh, what do you mean? I said, well, we've actually, you were taking care of people in these internally displaced persons camps, and they've been burnt out of villages in central Sudan so that the Chinese could do oil exploration, without people, bombing the pipelines and whatnot. And you take care of the people in these camps, and you pay nurses, and that nurse salary can take care of 40 extended family members. And so you actually manage these camps for us and keep the ranks of the SPLA, or the Southern People's Liberation Army, from swelling. And that's the enemy, that's the army we're fighting against. So you're all part of our political strategy. I thought, wow, naive me. I didn't know that politics were weaved into aid and humanitarian work. And that's I think was where I started thinking about it and seeing it, and then realizing that it wasn't a novel thing, that even as early as the 1960s, Kwame Nkrumah was talking about how aid is just a revolving door for global North countries giving a little with one hand to disguise what's coming out with the right. And so as I worked in different environments, mostly in Southern and Western Africa, I started to see, aid and humanitarian work as this double-edged sword, as, doing good work and saving lives, but at the same time, doing ideological work. And the book is about how, even beyond some of the aid and humanitarian work, I saw it built into what we call public health science, such that a lot of the work that we would think of as just kind of objectively neutral epidemiology or study of disease burdens actually does a fair amount of ideological work. And so the idea in the different chapters is to kind of explore how this occurs. Well, you think of anthropology and sociology as kind of contextualizing disciplines. I guess I learned the tools of critical theory and learning how to even do some of the epidemiological modeling myself, so that I could see and understand the language being used. So you could say my tribe that I studied was essentially the WHO and the epidemiological groups of the North, and they have their own language, and they have their own rituals. And so I guess the training helped me kind of transcend my own involvement in those circles to sort of see it anew and report on it. framework, coloniality, was developed by some scholars in South America, notably Anibal Quijano from Peru. And it essentially states that the colonial frameworks that were put in place over a period of 450 years, they've actually transcended independence of former colonies, that such that we still live under this same colonial power matrix. And after independence, we've essentially moved from an era of global colonialism to a current period of global coloniality. Another scholar, Sabelo Ndlovu from South Africa, he describes the term as, despite the celebration of decolonization as a milestone in African history, that the continent has not managed to free itself from epistemological colonization, inscribed on the continent and its people by mission and secular schools, religious denominations, and other institutions that carried Western cultural imperialism. And so what I tried to do with the book is to demonstrate that actually, to add to that list, we could throw on schools of public health and schools of medicine that seemingly do objectively neutral work in trying to understand disease burdens, but actually carry a fair amount of Western cultural imperialism with them. And by exposing that, I think we can find, different ways of interpreting social phenomena, ways that actually support ideas of justice instead of ways that continue to support, neoliberal views of the world, continue to, at least whitewash or not challenge the extraction, the extractive activities that continue to this day. It's easy to notice when you get there how rich these countries are. Sierra Leone, the district I was working in, is very rich in diamonds. That movie Blood Diamond was actually about the Kono district in Sierra Leone. And then DRC itself, with gold, diamonds, cobalt, all of it. Extremely rich countries that, we did an analysis for Sierra Leone and basically showed that, just taxes alone that have been avoided on most of the minerals that have been thefted or extracted from the countries would have built health infrastructures that could have stopped Ebola in its tracks. So it's very easy to see historically how legacies of colonial and imperial extraction just set the stage for these huge outbreaks. And those sort of colonial frameworks or ways of seeing the world or ways of being in the world, continued up to this present day. So in Kailaun, where the MSF Ebola treatment unit was, although really it's questionable whether the word treatment should be there, they wouldn't let us put in IVs. So patients are coming in shock, and we weren't allowed to fluid resuscitate them because I guess they thought it was too dangerous potentially for us and all that PPE. We might stick ourselves, etc. And Partners in Health came with a mandate to really be as aggressive as we could about treatment. And Paul Farmer has a book out just recently called Fevers, Feuds, and Diamonds, and he really does an amazing job of tracing the actual colonial history of this kind of containment over care paradigm of just going into a place and using isolation and quarantine strategies instead of actual medical tools on hand to care for patients. And so that was another way I think Partners in Health was transformative in focusing on care. And then once the outbreak started in DRC in 2018, I think the dedication to care was there. WHO, Olima had great setups for really prioritizing as high a level of care for patients as possible. One of the examples that I use in the book is of a Harvard School of Public Health study that examined why there was such a huge outbreak in DRC at the time I was there. And essentially what they published in a very high impact journal was that the people had their own ignorance. They had their belief in misinformation, their refusal to accept Ebola as something real, to blame um, for the explosive spread in that particular outbreak. And that, to me, while it's true enough in the sense that they gathered these facts, that people said these things, what it does is support an intervention that furthers aid, NGOs coming in and helping, not only to treat patients, but to kind of convince people that it's real, to set up WhatsApp groups and focus discussions and all these things to like rationally convince people that, everything you're hearing on WhatsApp is misinformation. If only you would believe it was real and take the vaccine, there wouldn't be any problems. Another way of looking at it is actually, furthering the discussion with people. Why do you think it's not real? Or why do you think that it's a US bioweapon? And then you start to understand that, it's not lost on anybody there that, their ancestors had their hands cut off by, King Leopold and the Belgians for, not collecting enough rubber, and that there was further extractive activities under when they were a Belgian colony, and that Belgium and the U.S. colluded in the assassination of their first prime minister, and Patrice Lumumba, and that after that the U.S. installed a Cold War puppet dictator, paid him peanuts, essentially enough to run the country, while our companies were able to extract what they wanted from the East. And that type of extraction continues to this day. The Anglo-Gold Ashanti, by one report, gets 93% of the wealth out of the ground to the global north. And so it's not lost on people that these are the legacies they're dealing with. And so, what sounds like ignorance is actually more of a critique. It's a historical consciousness. It's kind of a structured disposition towards eluding these centuries of depredation that they've experienced. Why all of a sudden after 200 years is the white man showing up in a Jeep someone that's not on the take when every single other person has been? And so if you look at it like that, and you understand their interpretation as not one of ignorance, but as more of critique of historical consciousness, then the intervention is not more aid or sitting down and trying to change people's minds. It's actually repair of those legacies, or reparations.